Okay, so the big question that I think most people have is, what do I do in order to stimulate neuroplasticity, and does the type of training matter? And I can unequivocally say absolutely, and it's not okay to just sit in front of the TV and do exercise or marching or some sort of movement. And so my goal in the next couple of slides is to explain what exactly you have to do in order to stimulate neuroplasticity. It's not as easy as one would hope, but it's a very hot term right now in all of the literature, and online there are a lot of programs that you can use to stimulate neuroplasticity. Our goal is to demonstrate how you stimulate neuroplasticity as it relates to movement. So there are some wonderful researchers who have researched this quite a bit about what exactly do you need in terms of environment in order to stimulate this neuroplasticity. So Klein and Jones are these wonderful human beings who have studied this so that we don't have to study it. And essentially they've come up with a series of standards that must be met in order to achieve neuroplasticity. We're going to go through each one of these independently, but essentially what they've done is they've given us a checklist both from a PT perspective in physical therapy, but also for how you adapt day-to-day life at home. So if it's one thing if you're going to be training with your therapist or you're improving upon a neurological injury, but it's another if you want to use these processes at home just to improve your overall brain health. Both of those are applicable. So step number one, we know that in order for somebody to achieve neuroplasticity, they have to use parts of their brain, or else they will lose the capability for that brain to function. So I think oftentimes we've heard this phrase of use it or lose it, and we think of it almost more so for muscle or for bone, and we think about having to stimulate those muscles or bones in order to keep them strong. But it also applies for people with brain health as well. So it can be applied in many different ways. One example would be if you were to do games online, for example, then you're able to stimulate your brain in terms of creating puzzles or solving problems that you wouldn't normally do. Another example would be for somebody who has had perhaps a decline in their strength as the years go by. If they're not utilizing that strength more regularly, then they're going to have a hard time stimulating that part of the brain that controls that particular movement. So what we want to do is we want to promote the idea of using different types of movements and using different types of novel activities so that we can stimulate parts of the brain that wouldn't normally be stimulated. We also know that the more we use something, the better we get at it. So this idea of use it or improve it comes down to the idea of if we can give an activity that will help to stimulate the brain in a way that we keep practicing and we keep utilizing, then we know that it's going to make that area of the brain stronger. There's a lot of research out there right now that correlates to different types of neurological decline, and we'll actually discuss that later in this talk. But just briefly, we know that sometimes it's not even the area of the brain that's being stimulated. More so, it's actually the pathway that leads to the brain. And so by using different parts and doing different activities, we can actually stimulate the brain more stringently and force it to be utilized more effectively. So it becomes quicker at being utilized, and we can use that part of the brain faster, more repeatedly, and when we want to use it, we can trigger it. Okay. We also know that the specificity of the task that you're doing actually matters. And we'll talk quite a bit about this in terms of research as it relates to people who have had neurological decline. But we know that if we want to get better at swimming, then we need to practice swimming. So unfortunately, if I go out and I want to be a champion runner, I have to go out and put in the hard work, and I have to be very specific about my practice so that my brain and those parts of the brain that feed that movement and feed that quality will be improved upon. So when people ask, I want to go out and I want to be able to walk with better balance, or I want to be better at remembering things, that means that we need to practice those exact things. So if there's a task that you really enjoy and that you want to get better at, then it sounds almost simplified, but we want you to go out and practice that specifically. Okay? So if I want to get better at biking, I'm going to go out and bike. Okay? We also know that the quantity matters, and the quantity is a really high, large amount. And unfortunately, it's an intimidating amount. I'm not even going to throw out a number, because usually once we start saying the exact number of hours of repetition that's required to stimulate change, people run away fearfully and they never want to come back and see us. The important thing is, it's not necessarily repetition of exercise per se, it's repetition of a certain task that can translate to that actual activity that you're looking to improve upon. So repetition doesn't necessarily mean that I have to do 80 squats in order to be better at squats. It can also mean that I get up from the chair the same way, utilizing the muscles that we want to use. That means that I engage when I going up and down the stairs. Maybe I'm using the same muscles in the same way. And there are also components to that that feed into being able to translate from one to the next. Okay, so repetition is key. We know that we need to repeat the movement or the activity of any type of activity in order to improve the quality. Okay, and on that note too, we know that intensity, unfortunately and fortunately, does matter. So if you go to the treadmill, if you're at the gym and you go to the treadmill, you see the person next to you and they're kind of cruising along at a nice slow pace and they look really comfortable and they're probably reading a magazine, and I know I've been this person myself, so shame on me, but you know that if it looks really comfortable, it may not necessarily be stimulating neuroplastic change. And that's not to say that it's not causing improvements in other areas. So perhaps maybe it's improving flexibility, or maybe it's improving aerobic capacity, but in terms of actually stimulating change within the brain, it's entirely possible that without pushing the brain and forcing it to do things that aren't necessarily comfortable for it, that it may not instigate a change that we want. So a great example would be somebody who has had a stroke. If they're on a treadmill and they're walking a very slow and comfortable pace, then that would be comfortable for them, and they'll probably be very happy with us. But what we need to do is we need to stimulate to the point where the body is a little bit uncomfortable. And that's not to say to be in pain, but more so that they're at a point where it's work. Like they actually have to put in this effort in order to stimulate an improvement. And basically that's what starts to feed into those factors that Monica was speaking about, where you get the neurogenesis and synaptogenesis. Our body basically builds new processes based on the challenges we place on it. And that's the same with bone, and the same with muscle, and the same with the brain. So the more intense we are, and the more specific we are about that intensity, the more likely it is that our brain's going to respond to that challenge appropriately. Another thing that we know is that time matters. So that's not to say age matters, although that is another factor. What this means is if there's a new injury, for example, to our brain, we know that we have to get in there the earlier, the better. There was research that occurred that essentially insinuated that the first 6 months are the only time when you can implement change post-brain injury or post-stroke. And that's since been negated. But it is true to say that if there's an injury, that the earlier we start retraining the brain, the better it is. It doesn't mean that you have to start at that time or else no change will occur, but it does mean that the brain is primed to make change at that point. So our goal is to pick the time that's most appropriate and to have people come in whenever they can really stimulate the most change. And that includes for our patients that are coming in to change, perhaps get better at a certain type of exercise or to improve their cognitive level. We know that in order to get them in, the earlier that becomes a problem, the better it will be and the more improvement we can anticipate seeing. So the earlier we can see somebody with some sort of injury, the better. If somebody has a neurodegenerative disease, the same thing applies. And we'll discuss this a little bit more completely when we talk about diseases like Parkinson's disease or MS. In those situations, we know that there's going to be a degenerative process that's occurring, but the earlier we stimulate the brain to grow new areas, the better. Okay? If we wait too long, then the brain starts to create patterns that are not efficient, and they're not necessarily good quality patterns, specifically for movement, because it's a very complicated process. We also know that salience matters. So for those of you that might not be as familiar with this term, it essentially means that we want to do things that are important to the person. So if I am doing something like dancing, I don't care about dancing. I'm not good at dancing. I don't want to be good at dancing. So if I practice dancing, I might get a little bit better at it, but it's not as meaningful to me. It's not something I want to get better at, and so therefore I'm not going to get as much better at it because I'm not going to put in the effort that's required. The brain really enjoys, one, challenges, but also things that are meaningful to it. So I get the question a lot from patients who come in. I've heard this research study, and essentially people have said that if I cycle, then I will reduce my risk of this, this, and this. And so does that mean that I have to cycle? And I'm sure I annoy all of my patients, but essentially what I tell them is, do you care about cycling? Is there a way that we can modify the treatment so that cycling is not what you necessarily need if you don't care about cycling? And this is important when it comes to neurological rehab as well. If we give somebody a training pattern that they need to work on, but it doesn't mean anything to them, one, they're less likely to practice it. And so the idea of them doing their homework it kind of goes down in terms of frequency. But two, also, it's not going to trigger the parts of the brain that essentially say, wow, good job, you did a great job, and this is meaningful, and this is going to be applied in this way in the future. So we always make an effort as therapists to try and make it applicable and to make it salient for the patient. And it's especially important when we're talking about people with neurological decline. So we come to the age question, because unfortunately I kind of led into it as though age didn't matter. It does matter a little bit. So we know that the younger you are, the more likely you are to be able to stimulate new parts of the brain. And I think that's the same with almost every part of the body. We know after around the age of 25 that things start to decline. And I think for the vast majority of us, we are all in the same boat in that it's hard. It's like having a car that needs maintenance. So we know that a car that is brand new is going to be easier to keep maintained than one that is quite a bit older. Okay? What this means is that it just takes a little bit more work and a little bit more time and a little bit more effort to stimulate change. So the older you are, it doesn't mean you can't change and you can't learn new things and you can't stimulate neuroplasticity. It just means that we have to adapt and we have to approach things slightly differently. Okay, so if I have somebody who comes in and is 95 years old and wants to learn how to adapt their tennis stroke, and that is a true story, somebody really did that, then that's okay. But it means they've learned patterns of movement that we might need to adapt to. It means that we might need to relearn different tasks. And it also means that it's going to take more time to stimulate new growth and new changes in terms of movement patterns. So it's something that we take into mind, and it's something that I always tell my patients when they come in, that we want to make sure that it's a reasonable expectation that you may not learn how to do a certain movement as quickly as somebody who's 17 years old. Now, they may not learn as well because it's not salient to them. So, it's kind of a win, or it's kind of a give and take a little bit. But we do know that the age matters. We also know that if we teach one skill, then there's the potential that that skill can transfer to another skill. So what transference means is that if we have a body of skills and we have a toolbox of skills, we don't necessarily have to teach an independent skill for every single thing that we need to learn. A great example is sit to stand. It is often very hard for people to get up out of their chair if they have neurological injury, but also just as we get older and our joints get a little bit stiffer, it takes a lot more weight shift to be able to shift out of a chair, and specifically a low chair. What we know is that we don't have to necessarily practice sit to stand and only sit to stand in order to stimulate change. One thing we can do is we can take components of that sit to stand that are similar, and we can repeat those components with the patient, again, in a way that's hopefully salient and important to them, and with repetition and all of these other factors, but to be able to then take those components and combine them together. So it's similar to taking a puzzle and putting all of the pieces together with the puzzle and essentially saying, okay, I've got my sit to stand that I've been working on, but I also have, being able to move and reach, because that stimulates the same part of the brain that helps me to shift my weight preemptively for my sit to stand. Or it might be something like, okay, if I go from sitting to standing and I step forward, what components of that step forward are going to then feed into my sit to stand? So one of the fun parts about being a neurological therapist, or even a physical therapist in general, is that we get to take those parts of the puzzle and we get to analyze the movement in a way that combines all of those movements one right after another. So hopefully you're not being given 20 exercises in a period. And if you are, then shame on us, and you should yell at your therapist for that. So ideally, you shouldn't need to do so many exercises in order to gain those skills that you're looking for. And it also depends on if the movement is more of a continuous movement versus a very discrete movement. If I know that I want to work on cutting with scissors, and it's a very specific movement, holding the scissors, cutting the scissors, opening and closing, that's one thing. And I want to be specific about that. But if I want to get better at dancing, then there are a number of skills that I can take from that dance to be able to work on them part by part and then combine them for the whole. Transference lets us do that so that we can combine your skills and hopefully maximize your time and your efforts and still let your brain be nice and powerful as we do it. We also know, conversely, that it's a two-way street with neuroplasticity, and unfortunately, we can learn bad habits as well. And I think almost everybody in the crowd can probably attest to this, that sometimes it's easy to learn a bad habit, and then it's really hard to pull it back again and unlearn that habit. So one thing that we like to do as neurotherapists is really kind of harp in on what that good habit is, and I frequently have my patients yell at me a little bit for nagging them. But the reason why we do that is because if you're learning skills, you may not be learning good skills. So just because you're learning skills and your brain is plastic doesn't necessarily mean that everything you learn is going to be magnificent. What we need to do is be sure to give you a guide so that the things that you're learning are appropriate and they're really going to stimulate the brain in the right way. We don't want them to be maladaptive. Okay? So the goal is to stimulate the good stuff and avoid the bad stuff. And, for example, if you have a neurological injury which limits your ability to do certain movements, one thing that we want to do is make it so that you're not necessarily only learning adaptive stuff, but also stuff that can help to promote, again, new movements, appropriate, using the stuff that's been injured if possible. Okay, so one thing that we know is that the brain without exercise can be a bit of a tricky thing. And once we stop, it's hard to stimulate that. Just to reiterate what happened in the video, I know, because I could hear some murmurs about the quantity of aerobic exercise that's recommended. It's a lot. It's at least 150 minutes of regular aerobic activity throughout the week, and a certain percentage of that being high intensity. But the important thing to note is that when we're looking at the amount of time and we break it up into days, it actually isn't that bad, particularly if you break it up into chunks throughout the day. Keeping in mind that there's a difference between just doing aerobic activity and doing something, again, that is salient and meaningful and that has a little bit more intensity to it. So I think there's always a little bit of fear involved in like, wow, that sounds like so much exercise. But it could just be walking from the grocery store to your car that's a little bit further out, or walking up and down the stairs instead of taking the elevator. And it also depends on health and what kind of other factors you have in your health as well. So ultimately what this comes down to is that we know that there are certain factors that will stimulate that neuroplasticity. We know that without exercise, it can become very detrimental for everybody. And we know that ultimately, if these changes occur in a normal brain that doesn't have a neurological change, then what is that going to do for those that have some sort of neurological impairment, or a disease process that's degenerative? So the fun part about physical therapy is that we get to combine not only what is in a normal brain, but also what is in an abnormal brain. So we get to figure out what is abnormal about it, and then figure out which way can we navigate and which way can we circumnavigate so that there's a way that somebody can do the functional task that they are trying to do. Okay, and Monica is going to step in with about multiple